whether you want to go with that, and two, where it should be. Anyway, thank you very much. Right, someone's going to be circulating with a microphone, so fire away with your questions.
Thank you for the lecture. You mentioned costs.
Yeah.
You mentioned the physicality of the structure of the hospital. But the one thing that perhaps is the big elephant in the room that everybody is thinking about at the moment is liability, negligence, and the management structure that ought to go with a modern hospital.
Yes.
Have you put any thought into how that management structure can be delivered to give us what we need in the future?
Well, I mean, first of all, I mean, if you're making a reference to mid-staffs, to a certain extent, I suppose, in your question, and actually, first of all, this project could have been about 15 times bigger if I'd have covered every single issue. I mean, there was a point where I had to draw a line. The second thing I would say about mid-staffs is that serves 230,000 people on 2 sites. Part of the problem at mid-staffs was because they couldn't deliver the care on 2 sites. They couldn't staff it properly, and they were trying to hit financial goals. And so, actually, mid-staffs justifies doing this in that way. Your point about management in terms of leadership on this, and actually getting it done, this is a problem. This is a real challenge because there isn't an organisation responsible for consolidation of acute services. There's actually nobody offering leadership on this, which amazes me. I mean, the DOH employs lots of people. I've yet to work out what they all do. Because if this doesn't register as the most important thing to be doing at the moment, I don't know what does. In terms of the infrastructure challenges that the health service has. I think that, so as a result of this, we have to wait for acute trust mergers. So we actually have to wait for financial crisis to drive mergers of trusts so that they then go, oh yes, okay, maybe we only need 1 site, not 3. And unfortunately, that's how it is. And I try to offer some leadership in doing this, but I recognise the limitations. With reference to management in general, I'm not an expert in that. I think there's too much management in the National Health Service, and I think there's too much of a jobs merry-go-round as well in the health service, and which is also, you will see in mid-staffs. I mean, the intriguing thing to do is to follow where those people are now working. It's quite a remarkable story. And so I'm also sure that I'm here to sort of design the management of the hospital. I do think, though, that it would be hugely important to get a chief executive, possibly from outside of the health service. I think part of the problem that I see in the health service is that there's a lot of people who are very much part of the health service and don't think outside of the box enough in terms of how they design their services. I think the health service actually is too big, and I think it's showing signs of being too big, and in terms of its culture, and I think that that's actually the nettle that the politicians are going to have to grasp at some point. Sorry if that's an incomplete answer to your question, but I don't feel qualified to answer in detail about hospital management.
I'm Paul Hartman from Buckinghamshire County Council. I'm Paul Hartman from Buckinghamshire County Council. I'm just wondering kind of how much political support that you've got for this.
It's quite interesting, actually. The political support seems to be appearing now. People are starting, oh look, they're merging. Those 2 trusts are merging. And I was at a meeting the other day, and it was like people who'd been sort of advising me of the political consequences of my stance were suddenly coming up with ideas of where the hospital should come and how they'd always owned the issue and how they'd led on it locally. And I just looked at them and I just thought, is this the same man who, I won't go into details because you'll know who it is, and I was just looking at them going, okay, suddenly you're now a disciple, are you, to the cause? I think it's been difficult because historically politicians, instinctively, they don't do this sort of thing. It's bad politics. I remember speaking to a member of Parliament about 6 months in, and I was talking about this, and he turned to me and said, "You're new to politics, aren't you, Philip?" And I felt like saying, "Yeah," I said, "but I recognise being patronised. I might be new, but, and yet that person is now persuaded." I think it's been difficult because it's not easy to come out as a member of Parliament or as any politician really and say, look, we've got to close some services down and we've got to consolidate them onto a single site, because the general public, understandably, worry about the hospital not being down the road. And so all of these meetings have been about actually me trying to assuage that concern and say, well, look, there's nothing to be gained by going down the road to your local hospital if there isn't a properly skilled and equipped clinician there to deal with you. You'd be better off spending 5 or 10 minutes longer in an ambulance and go to a place where there is a properly equipped clinician in the right environment, with the proper staffing, with the proper support. And I think that that's a difficult discussion to have. It's very difficult in the media because the media, concentration span of about 5 seconds. So therefore, it's like boom, 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 boom. So I've been misquoted. I've lost count how many times I've been misrepresented over this. And it's very difficult to get that over. But I'm getting there. I did daily politics 2 weeks ago. Nicola Horlick, the fund manager lady, was on it. And there she was, non-executive director of Hampshire NHS Trust, nodding vigorously, agreeing with me, saying we had too many hospitals. So there's a sense of movement, but it's not easy. But I've got support. Most MPs in this area are supportive. They're cautious publicly.
So would you categorise that as enthusiasm or benign acceptance?
I think Theresa May is 100% enthusiastic. Theresa's 100% on board. The others, I think, are recognising that the ground is shifting. And so therefore, I think they're being less cautious about defending, or less eager to defend the current status quo. And I think that's progress. Because, the sort of the image of, I refuse to be party political in any of these meetings. I really have done. And some people have tried to be party political at some of them. But this image of, the one I remember is Hazel Blears had voted in cabinet to have a hospital closed. And then on the Saturday morning, we stand outside the hospital with a banner saying, "Save my hospital." And the problem with that is it actually erodes trust in politicians. But it also stops progress. That hospital now I think it's closed. I don't think it exists anymore. And I think that it'd be much better if politicians said, no, actually, I want you to support me in this because I think this is going to be better for you, his constituents, which is actually what I'm trying to do in Bracknell. And I actually think the people of Bracknell have been quite supportive. I think I've had some pretty, on balance, pretty favourable. But unfortunately, there is an element of it being party politicised in Bracknell. And I think that's a really sad situation. The Labour MP who was on that daily politics show with me walked away from Millbank saying, "You're right." And I turned to him and said, well, if I'm right, how come your local Labour Party is campaigning it'll save Heatherwood Hospital and making out that somehow I'm lacking compassion and lacking the understanding of my constituency? And he sort of went like that. And I said, well, this is not party political. This is about what's good for the country. This is about actually having some vision, some strategy. This isn't about trying to score points and increase majorities. How can it be? Because by definition, if you're consolidating every 3 hospitals into one, there's a lot of constituencies that are going to be without hospitals. Because there's only 77,000 people. You need 10 constituencies per hospital. Can't be party political, can it? By definition. Next question.
Thank you. Philip, one of the things I guess concerns me most about how a project, a decision could be taken forward, is actually the mentality of management in the NHS. You make much of the attitude of local politicians, but I would say, as a councillor, that one of the big issues is a very cautious, non-public facing style of management in the NHS. If it was more publicly facing, then when we talk about the merger of trusts, we'd be talking about the merger of equals, not trusts who deliver services of very different competence, quality and level. So my question is, how do you overcome that obstacle? Because you might get every single member of parliament, you might get every single local council signed up to it, but the bureaucracy, the complete inability of NHS management to move forward will get in the way. And is one of the routes to get the clinical commissioning groups and the other structures in place on side to share that vision and drive it, because ultimately they will be the ones commissioning services from this super hospital.
Yes, I mean, I broadly agree with what you just said. I guess my issue with local councillors is the rather perverse decision of Windsor and Maidenhead Borough Council to not support the plans to move services from Heatherwood to Brandsbridge. I mean, it just doesn't make any sense, that decision.
It does if you're a councillor in Windsor and Maidenhead.
Well, no, it only makes a decision if you're a councillor in Ascot. It doesn't make a sense if you're a councillor in Windsor, because 80% of the care is for Slough residents. Unfortunately, it sort of reinforces the problem of a lack of understanding of the subject. And I stand here as a Member of Parliament. I have absolutely no say over the provision of healthcare, but a local council can call for a judicial review. And I think, fine, that's the way the structure is, but can those councillors please become experts in this first? Because, you know, the local council sort of health and scrutiny committee that oversaw the baby unit, maternity unit being opened at Heatherwood, 2007. I mean, who made that decision? Delivers less than one baby a day. Who was on that committee? I mean, it just does beggars belief, Karen. Now, where you're right is the management and how they're not public-facing, and how a lot of these decisions over your hospital services are made by people you probably have never met, who wouldn't turn up at a meeting like this necessarily. They would do on their own terms. And I think there is a lack of democratic accountability for healthcare services, which I think is pretty shocking. It was only actually when I became a Member of Parliament I realised how little accountability there was, and the people who were in a position of being democratically elected, holding the people to account, weren't qualified to be holding them to account. And so, yes, I think you're right. I've made this point at the Department of Health. I've said that there isn't enough leadership when it comes to actually having strategic vision. I mean, the Strategic Health Authority. There's no evidence of strategy in this area. What was the Strategic Health Authority doing? I thought that was their purpose. You know, I mean, it's sort of, and so there is a problem of driving this forward, for sure. And I'm trying to support them. And that's why I was so frustrated by Windsor and Maidenhead Borough Council's decision, because actually what they were proposing was a step in the direction of this. They were essentially saying, we need to move our services to more population-dense areas, and we also need to deal with Heatherwood, because Heatherwood is, you know, it's only viable because of the good people of Slough, which by definition doesn't make any sense, does it? But, you know, we are where we are now.
Good evening. I'm very sorry I was late. Some sat-nav sent me via the M25. My brain was not in gear. The difficulty that you have with gaining support must come a little way from the memories that other people have of building big hospitals or expanding hospitals and removing local facilities. For example, when the John Radcliffe 2 was built, they sucked, I think that's the only word I can say, they sucked out the life of an exceedingly large number of very small, very competently GP-led hospitals throughout the Oxfordshire area. And, for example, the one at Wallingford, where I used to live. And the hospital there, again, as I say, it's a GP-led service. It provided maternity facilities for ladies who had absolutely no problems and whose real alternative was home births. It had fairly quick access if it needed emergency treatment to other places. But they closed them down. And I feel that that was something that needs to be looked at to see whether we could enhance the facilities of some very small units, a GP-led, for overnight accommodation, such as the proposal for places in Bracknell.
Okay, well that's my plan, Andy.
Sorry.
Yeah, I mean my plan is to enhance community services. You know, the great majority of money now spent on healthcare in this country is not on the fancy stuff in acute hospitals, it's on chronic care. And we have an ageing time bomb here. Dementia is doubling in the next 10 years. Diabetes is going to be 25% of the NHS budget by 2025. Depression's going up. All of that, except the acute diabetic crises, but all of that is managed in the community. It can be managed in community clinics, GP practices, community hospitals. The problem is, Andy, is what you're worrying about these services being bled dry from communities, is more likely to happen if we maintain the Heatherwoods, the Wexhams, Wickhams, and everything else. What I'm suggesting is that because medicine has changed so profoundly, I mean, the advent of one drug has reduced the heart failure admissions in the first thing in the morning. Okay, so it's changed so profoundly that you don't need as many acute hospital sites. You can have more, by definition, community sites offering outpatient appointments and the like. Your point about maternity, it's a difficult area because the morbidity and mortality statistics surrounding midwifery-led units compared to obstetric-led units, you know, it's a difficult one. There are a number of women who want to have their babies at home and things like that, and that's their choice. But if you're going into a hospital, I personally, you don't know whether something's going to go wrong, Andy, and if something goes wrong in delivery, boy, you know about it. Ask the Earl of Wessex's wife. You know, she ended up in Frimley Park and having a postpartum hemorrhage, and it was touch and go. And so the fact that there were obstetricians around was hugely important.
I think one of the features that they had at Wallingford was that you gave birth at either Oxford or Reading, and then you returned the day after or so to another 5 days.
Fantastic. I'm all in favour of
They
this.
closed it all down.
Because they're constantly trying to suck away to provide services all the time on these acute sites. And so if you have fewer of them and you have more community care, you are actually reflecting how healthcare has gone, which is more and more care can be delivered away from an acute site. But that means that hospitals are no longer as viable, which is what's happening to Heatherwood and Wexham, it's what's happening to Frimley, it's what's going to happen to Royal Berks. Because you're taking care away from them by offering it in the community, they're less able to be viable. This is the problem. This is what's driving it. It's actually positive because you will have your outpatient appointments closer to where you live, Andy. You will have your post-operative care if you have an operation closer to where you live. You don't want to be sitting on a district hospital ward anymore. This is yesterday. District general hospitals are yesterday. They're not coming back.
I agree with you, but how can you overcome the appalling management that the NHS has had, and particularly the strategic area health authority, who makes the decisions?
Well, we've got rid of them because they won't do
local things.
Sure. And I think there is a problem. I mentioned it earlier. There is a problem with structure here and with managerial competence and with culture. And you saw the worst examples of that in Mid-Staffordshire.
But do we get rid of Nicholson's completely out of the
Well,
rather than...
You're drawing me to disagree with my Prime Minister here.
Without embarrassment.
But personally, I look at it and think the Chief Executive of a Strategic Health Authority that was responsible for Mid-Staffordshire Hospital being in charge of the NHS, I have trouble with.
Okay, well,
But anyway, next question.
Mr. Cameron doesn't do either.
Another question? There must be more questions.
Yeah. mean, I'm all in favour of your plan and have been ever since I've heard it. I think it's long, long overdue. Having an acute hospital like the John Radcliffe saved my daughter's life, even though she had to travel from Aylesbury back and forth, but that saved my daughter's life. All these silly little hospitals all around, scattered around, you know, it's just sucking money. It's not just care, but it's sucking the money of the National Health Service, which we've got to be realistic, we have not got. Therefore, I mean, you put Upton Hospital there, I wouldn't touch it with a barge pole. It's knocking down the building houses.
Just as a community hospital site. It was just to provide the care.
Yeah, I know. I've been in Upton Hospital, I've been in there several times.
Yeah.
I would hate to have I hated my mother being in there, because it's such a bad hospital. As for Heatherwood Hospital, this white elephant hospital has been going on for years and years and years. It's a lovely little hospital, it sits in its lovely little grounds. But as you rightly said, it doesn't actually take anybody from Ascot area at all. All it takes is the people from Slough. And then the people from Slough moan because they've got to travel there. They can't get there. So, you know...
I have to refer patients from Slough.
I know you do. I get
Keep your well.
The idea of a road from Bracknell up to there is long overdue. It's long overdue. And it certainly would open that part there.
Yeah.
The fun and games going with High Wycombe and Stoke Mandeville hospitals is interesting. Sometimes I go past that road and I'm hitting ambulances roughly down to Stoke Mandeville and rushing back.
Because it's not in a sensible location.
No, it's not in a sensible location. No parking.
I mean, I wish this thing's gone and switched itself up again.
Yeah.
It's
in the wrong place, I know.